All right, guys, it's Dr. Muhammad. We are going to kick off the second section now, and this is going to be all about communication. In the first section, we talked about ethics, we talked about ethical principles, talking to patients, determining they have decision-making capacity, getting informed consent. Now we're going to talk about how to be a more effective communicator with patients. This is going to be a quick section, but it is also very important. We're going to talk about interviewing patients, the basic flow of the interview, how to build relationships with patients, delivering bad news, that's going to be this section. And then in the next video, we're going to talk a lot about inclusive interviewing with regards to gender and culture, sexuality, disabilities, all of these different things. So this is going to be very, very important stuff. So we're going to talk about interviewing patients, and this information is going to be important both for the exam and for life in general, right? Because this is at the core of what we do. We are only able to do medicine because we interview patients. So we got to get this right on the exam, and we got to get this right in real life. We're going to go through a basic flow of the interview, and of course that's going to start with the introduction. The important things to note here: give your name, introduce yourself, ask the patient their name, how they want to be addressed, sit while you are talking to the patient, do not stand over them and try to convey superiority. All of these things are important to the introduction. After we've introduced ourselves, we're going to try to identify concerns, and a big part of this is going to be coming up with an agenda. These are the things that we're going to talk about. These are the concerns that you have. These are the solutions that we can offer. Give the patient an overview, an itinerary of what's going to happen. After that, you let the patient talk, and you're going to listen, and you're going to actively listen. That means you're engaged, you're making eye contact, your body language, all of these things. Let the patient know that you're listening, that you care what they have to say, and that you are there for them. This is huge. Nobody wants a doctor that's disengaged, who's looking around, who's leaned back. Nobody wants any of that. Everybody wants a doctor who's going to look them right in the eye, who's going to care about what they say, and is going to react to what they say. So active listening is super important. After the patient has finished talking, we're going to validate them. These are concerns that a lot of other people have. This is not a strange thing. I hear what you're saying. All of these things are going to really build that physician-patient relationship. And after you've validated, after you've listened to all that, you want to summarize. Make sure that you got all the relevant information. Make sure that whatever the main point the patient was trying to convey is the same thing that you heard. And that'll also let the patient know this person really cares, this person really understood what was coming across. And after all of that, you need to allow the patient to ask questions. You need to encourage them to speak freely. There's no dumb questions. I've heard it all. Allow the patient to ask questions and maybe even reveal information that they haven't revealed to other doctors before. Maybe reveal that one thing that they weren't comfortable saying, but now all of a sudden they are. So going through an interview with that proper type of flow is going to be really huge on the exam and in your practice. The next thing that's going to be important when it comes to interviewing patients is building that relationship. Now, we've kind of already laid a foundation, but we need to talk about things a little bit more. So there's a couple different steps here as well, and that's going to start with creating a partnership. It's not you, the physician, solving the patient's problems. It's you and the patient working on their problems and solving them together. You want that to be a partnership. You want to be empathetic. Like I said, people have experienced this before. I've experienced whatever you're going through myself. Those kinds of things. Let the patient know that they can be comfortable. It breaks down the barriers and allows them to talk openly and freely. Take responsibility. If you do make a mistake, it's okay to apologize. Apologize when needed. There are studies that show that physicians who are apologetic, who admit to their mistakes, have overall better patient satisfaction because it makes them more human. It makes them more honest. That's what patients want. And then, of course, what goes along with that is you need to show them respect. You're not the person in charge. You're working with the patient. They deserve respect. Their problems need to be validated. What they're saying needs to be heard. So respecting your patients is huge. And then to kind of tie all of that together, you need to support them. What you're going through, I'm going to be here every step of the way. Any question that you have, anything that I can do to help, I'm going to help you with everything regarding this problem. If you frame it that way for a patient, they're going to want to try. They're going to want to do their part. They're going to want to work with you. And that's how you build that relationship with that patient. It's super important. Of course, things don't always go the way that they should, and sometimes there is bad news. And we need to know how to deliver bad news, and this is high yield, so it gets a high yield button right here. There's a couple different steps that need to be taken to make sure we're delivering bad news in the most appropriate way. And that's going to start with preparing the environment. What does that mean? Offer the patient to bring in support if there's a caregiver or a family member or a loved one that they want to have come in. Eliminate distractions. Put your phone on silent. Put your phone on silent. Put your phone on silent. These are important things you need to know. It's silly, but we've all given bad news and had the phone go off, so that's not something that we want to happen. Determine the patient's understanding. That's going to be really important. What do you know so far? And kind of gauge where the patient's at and meet them there. Obtain permission to give them the bad news. I've said it multiple times already, and it seems silly, but sometimes patients just don't want to know. If there's something bad, just tell my wife, or tell my husband, or tell my oldest son. He's the person that makes decisions for me. He has power of attorney, and they don't want to make those decisions, or they don't want to hear that information. So obtain permission from your patients. Make sure that it's okay. The next thing, we need to explain things in plain language. This is the same thing as when we were getting informed consent. If you're giving a patient a diagnosis of pancreatic cancer, it's not pancreatic adenocarcinoma. It has to be pancreatic cancer. Explain things in plain language to really make sure that the patient is understanding what you're saying. After that, we want to acknowledge their emotions. This goes back to the validation. This goes back to showing respect, to supporting them. This is how we're going to build that relationship. If you're feeling angry right now, that's okay. If you're feeling sad right now, that's okay. If you're feeling confused right now, that is also okay. You need to feel whatever you need to feel. Saying things like that to a patient is really going to help them deal with these tough conversations that you guys are having. And if after all of that is done, if they have any questions, if that's been addressed, you want to discuss next steps. You want to talk about the treatment options, the goals of care, if they're ready to do it. And if they're not ready to do it during this session, that's okay. We just want to support them. We want to meet them where they're at and make sure that they have everything that they need. So quick recap to make sure that we've got it all. The interview flow is going to be very important. You need to introduce yourself to the patient, identify their concerns, create an agenda. We need to actively listen, validate what they're saying, summarize what they're saying, and then make sure they can ask questions. In terms of building relationships with patients, we want to be partners with them. We want to be empathetic. We want to take responsibility when we make mistakes. We want to show respect, and we want to support them. In terms of delivering bad news, remember, this is high yield. Want to make sure that the environment's prepared. Want to make sure the phone's on silent. See if the patient needs any loved ones to come in and support them. Get their level of understanding, obtain their permission, and then explain things in plain language, acknowledge their emotions, answer their questions, and then prepare for the next steps. All very high yield information, and it takes practice, but it comes with training, and we'll all get there. So thanks so much for watching, and I'll see you in the next one.